support House Bill 2170. We're grateful for your time and consideration on this important issue and request that you are favorably report this legislation. Thank you. I'm happy to answer any questions.
Committee questions. Yes, Senator Holscher.
Thank you, Madam Chair. Thank you so much for joining us. This goes back to the questions others essentially brought forward earlier. Could you please help me understand the need to put this in statute when we already have October as a designation and there are proclamations and other things that are issued?
Yeah, so it is a little bit different. October is fire prevention, which is a little bit different than burn injuries. As is listed in my testimony, there are a lot of different mechanisms of burn injuries themselves. And so this would allow us the time to have formal recognition for education on a lot of those other methods besides just flame injuries that cause burn injuries to our citizens.
Additional questions, committee? A question that came up while we were waiting for you to be able to get on with us was, I guess, why a full week? Is there, usually we'll have like a day set aside for something. Can you explain that to us, please?
Certainly. So we're trying to align with our national organization, which is the American Burn Association, which is also in the process of going through the national leadership to get this recognized. But they have already designated as a week. There's a lot of education that has to happen. And in order to get to many different places, it would be very difficult to get to schools, to get with fire departments, to get even within our own hospitals in just one day. And so giving us multiple days allows us to kind of spread it out and get out to the public to get more of our message heard.
Additional questions, committee? Seeing none, thank you so much for being with us. Committee, this closes the hearing on House Bill 2170. We will now open the hearing on House Bill 2307. We'll start with a reviser's note from Jenna.
Thanks, Madam Chair. Members of the committee, House Bill 2307 transfers power to oversee and authorize certain activities regarding prenatal and postnatal diagnosed conditions, those awareness programs, from the Department of Health and Environment to the Kansas Council on Developmental Disabilities. There's a new Section 1, and it transfers the powers, duties, and functions of prenatally and postnatally diagnosed conditions awareness programs as provided in KSA 65-1-259 from the Department of Health and Environment to the Kansas Council on Developmental Disabilities. Section 2 amends the statute KSA 65-1-259 to reflect that transfer from the Department of Health and Environment to the Council on Developmental Disabilities. Section 2, specifically paragraph G1, establishes the prenatally and postnatally diagnosed conditions awareness programs fund in the state treasury, and it sets out the allowable uses for this fund. And G2 states that on July 1st, 2025, the Director of Accounts and Reports shall transfer $25,000 from the state general fund to this new awareness programs fund. This bill would take effect on July 1st, 2025, after publication of the statute book. The House committee made one technical amendment, and the bill passed the House on a vote of 122-0. And I'll be happy to answer questions.
Committee questions for Jenna? Seeing none, thank you so much, Jenna. Our first proponent is Mike Burgess. Mike, are you in the room with us? There he is. Welcome to committee.
Thank you, Madam Chair and members of the committee. I'm Mike Burgess, and I'm the Director of Policy and Outreach at the Disability Rights Center, Kansas. And I am so happy to get to go first because I hate following some of the real stars of the show who are going to be later on. So I'll be very brief because I think they'll tell you a whole lot more. But the Disability Rights Center, we are part of a network that was created under federal law with the DD Council. And so for full disclosure, I'm a designee and sit on the DD Council, but I will just say I can't think of a better organization for the sake of parents and families who would be receiving a diagnosis, either prenatally or postnatally, to have somebody to develop training and run this partnership, run the program They're a great entity who's uniquely qualified to be able to carry out the intents of this program. So with that, Madam Chair, I will save time for the other conferees and be happy to stand for questions at the appropriate time.
Thank you very much. Next, we have Jean Godden from Kansas for Life.
Thank you, Chairwoman Gossage, members of the committee. I'm Jean Gowden, Director of Government Relations with Kansans for Life. And as the previous conferee said, I do want to save time for those advocates who have come here from the Kansas Council on Developmental Disabilities. But just want to give you a little history on the program. It was first established in 2013, and the purpose for it was to present to families who are receiving a diagnosis, prenatally or postnatally, of Down syndrome or other diagnosed conditions, the information, the most up-to-date information on outcomes for their child, and also information on support groups. And so this program was designed to help train medical professionals who inform families of this diagnosis of the scientifically accurate information, and also connect those families to support systems and other families who may have children with some of these diagnosed conditions. So once again, I believe very, very strongly that the Kansas Council on Developmental Disabilities is the perfect organization to take over and implement this program, because they understand the needs of individuals with disabilities and their families. They are experienced at providing this critical information and support to them. And they also have well-established partnerships with medical professionals and various support organizations for people living with disabilities. So Kansans for Life is confident that Kansas families who are facing the challenges that come with prenatal or postnatal diagnosed conditions will be well served by the KCDD's implementation of the program. And I ask the committee pass House Bill 2307 out favorably, and I'll stand for questions at the appropriate time.
Thank you, Jean. And next we have Lola Colonel.
Chairwoman Gossage and members of the committee. I am Lola Cornell, the Advocacy Coordinator for the Kansas Council on Developmental Disabilities, and a peacemaker. Most importantly, I am a proud member of the disability community and a 20-year-old with Down syndrome. I attend Johnson County Community College and work as a greeter in fancy suites for the Chiefs and the Royals. Last week, I finished acting in Just Ask, a world premiere musical based on Justice Sonia Sotomayor's book about disabilities. I even met her twice and moderated a panel with her. KCDD empowers individuals with IDD and their families to drive systems change, build capacity, and advocate for inclusive communities where everyone belongs and thrives. On behalf of the KCDD team, we strongly support House Bill 2307. This legislation is critical because it ensures that parents receive not only medical facts, but also evidence-based, life-affirming information about their child's condition. This bill passed unanimously in the House. House Bill 2307 is personal to me. When my mother was advised to undergo amniocentesis during her pregnancy, she was not informed about miscarriage risks. When she asked, the counselor said, yes, there are risks, but there is a greater risk of having a child with a disability. Comparing pregnancy loss to raising a child who brings joy into the world is irrational. My mother, after multiple miscarriages, deserved accurate information. My diagnosis of Down syndrome wasn't shared professionally. While my mom was still in surgery, my parents overheard a nurse tell her colleagues that I had features of Down syndrome. Assumptions about my abilities continued, including a doctor exclaiming, "She can read?" Today, I can confidently say that I am happy successful, and thriving. I can read, write, work, learn French. Parlez-vous français, mes amis? Tackle algebra, not my favorite. And most importantly, I contribute to the world in meaningful and unique ways. People with disabilities are capable of so much more than the outdated assumptions suggest. When my parents needed support, they found it through peer groups, disability networks, and community resources. These connections provided hope, guidance, and shared experiences beyond medical challenges. While tests identify conditions, they don't measure a person's value. Parents deserve accurate, hopeful information. House Bill 2307 ensures access to a hotline, peer support, and guidelines for healthcare providers to share supportive, accurate information. I was fully included in high school and voted most likely to brighten someone's day. People with disabilities are kind, hardworking, and deserve to be celebrated. The world needs more love, kindness, and inclusion. Please support House Bill 2307 so parents receive the information they need to embrace their children's unique abilities, and people like me know we matter. Sarah and I will stand for questions at the appropriate time. Thank you.
Thank you, Lola. You and I have met several times. I don't know if you recall, but I've always enjoyed meeting with you and listening to your presentations. Committee, do we have questions for the proponents? Senator Hulscher.
Thank you, Madam Chair. No questions, just thank you so much for being here to share your story and your testimony. Thank you again.
Sarah, I have a question for you. Sarah Hartware, if you could come up to the stand. I'm trying to understand, I was reading the fiscal note.
Yes.
And so it seems that we should just be reducing the Kansas Department of Health's budget by the 25,000, and so it should not have an additional fiscal note. Is that correct?
In the past, when this bill passed in 2013, I believe there were no appropriations added to the bill. And so this, now that it would give us the jurisdiction to run this program, we do need some resources and to allow Lola and the rest of our team to partner with those medical providers and those disability organizations across kind of the entire state. So we're actually taking $25,000 of our annual budget and we're going to match that to make this a $50,000 program.
Okay, again, maybe we could talk offline about that, but it seems to me if they're not doing it anymore, so that should save funds from them, that it should be able to be passed over. We could talk about.
Happy to talk about that offline, absolutely.
Be glad to. And so, no other questions, committee? Yes, Senator Thompson.
Yeah, and Sarah, you could probably answer this. Do you help, I mean, when parents encounter this situation, and do you tell them what kind of landscape with regard to the IDD waivers, everything they're going to have to jump through? And because I think a lot of the parents in those situations are overwhelmed with, and I've got a grandson who's had to navigate this, been on the wait list for years. And so just speak to that real quickly.
Yes, thank you, Senator Thompson. That is part of our mission at the Kansas Council on Developmental Disabilities. We provide resources, information, and kind of that navigation piece you mentioned for self-advocates and for families all across the state. We really promote resources like getting on the IDD wait list as soon as possible. You all and your colleagues in the House have been tremendous at working with stakeholders and organizations like ours and DRC and others across the state and helping us chip away at the wait list. So again, thank you for your leadership on that. But we constantly provide resources to individuals and families. We probably get a couple of calls, emails, and messages through our portal a day for families that are seeking out that information. And that really goes beyond just waiver services. We also provide resources around financial means, whether that's special needs trusts, ABLE accounts, et cetera. So we really set up the next generation of individuals with disabilities and their families up for success.
Madam Chair. Thank you, Sarah.
Additional questions, committee? Senator Erickson.
Thank you, Madam Chair. Not a question, just a comment. Lola, I think your classmates were extremely perceptive because you certainly did brighten my day today. And I thank you for your very well thought out and reasoned testimony today. And I wish you all the best. Thank you, Madam Chair.
Seeing no other questions, thank you so much for being here, Lola. You did a wonderful job. Committee, this closes the hearing on Senate Bill 2307, and we will now move to two things. One, we will be having taking final action on 2075, and we will be having the conversation regarding the confirmation of Don Hall and Maureen Mahoney for the KU Medical Center Board. So we're going to start there, and we'll take them one at a time. So do I hear a motion regarding Maureen Mahoney? Yes.
Madam Chair, I make
Senator
a motion
Petty.
that we pass out Marie Mahoney favorably for the hospital, the KU. I'm sorry. Excuse me? KU Healthcare Authority.
So, and I'm just been passed a note that we need to say approve and consent.
I make a motion that we approve the
And consent to the nomination.
consent to the nomination of Marie Mahoney.
Okay. Do I hear a second? Second by Senator Holscher. All in favor say aye. Aye. Opposed, no? So we have approved, or we are passing out favorably her nomination to go to the Senate floor. Next, we have Don Hall. Do I hear a motion regarding Don Hall? Yes.
Chair,
Senator
I
Clifford.
move, we approve and consent for Don Hall to be reappointed to the Kansas KU Medical Healthcare Authority.
Do I hear a second? Senator Rose. It's been approved, or we have a motion and a second. All those in favor say aye.
Aye.
Opposed, no. And Don Hall we have passed him out as far as approval and consent for this nomination. And now we move to final action on House Bill 2075. And if, Jen, if you would just give us a real quick brief.
Thank you, Madam Chair. House Bill 2075 was the bill that we heard yesterday, and it would move up the schedule of permanency hearings from 12 months to 9 months, and then subsequent permanency hearings for children in need of care to be every 6 months thereafter.
Thank you. And we do have an amendment on this committee. And Jenna, would you please explain the amendment?
Thank you, Madam Chair. There should have been enough copies for everyone. I printed out like 25.
Does everyone have a copy?
Right.
Okay.
There's our extras, okay. All right, so these are just some little technical corrections. The first one is on page 2. Throughout this whole bill, it references ask the child if the child is able, and I found one instance where it says children, so we changed that to child. And then there is a list of placement options, and that list is typically with a fit and willing relative, a legal custodian or guardian, or an adoptive parent. That order is different in paragraph 3, so it just switches that order to be that the child be placed with a fit and willing relative, a legal custodian or guardian, or be placed for adoption. There's an extra or on page 3 in line 7, and then last on page 3 in line 34, the legal term of art is the best interests of the child, because a child has more than one interest, so it's plural, and so we change that singular interest to plural interests. And then on the last page, This is an unclear antecedent that we changed to be such civil case rather than just saying that case, so it's clear what case is being referred to for those custody issues.
Jenna, we really appreciate your attention to detail in all of the bills that come through our committee. Do I hear a motion on this amendment? Senator Blasey, a second. Senator Murphy, any discussion? Yes, Senator Petty.
Jenna, I just want to ask a question on page 2, down at line 30 and 31. It says strike all of line 30. So would that then read be a legal custodian or guardian or be placed for adoption?
Thanks, Madam Chair, Senator. So it would read, be placed with a fit and willing relative, and then that add-in language is a legal custodian or guardian or be placed for adoption. So it strikes line 30, so you would just go from reading line 29 to 31.
Okay, thank you.
Additional discussion, committee? Seeing none, all in favor of the amendment say aye. Aye. Opposed, no. The amendment has been approved. We're back on the bill. Do I hear a motion on the bill? Senator Holscher.
Thank you, Madam Chair. I move we pass out House Bill number 2075 favorably as amended.
All in favor say, second. Senator Clifford. All in favor say aye.
Aye.
Opposed, no. House Bill 2075 as amended was on its way to the floor. Committee, that is all the business we have for today, and we are adjourned. Opening this back up, Senator Clifford reminded me, Senate Bill 276 was withdrawn by the proponents. We weren't quite ready to bring that to committee, so we may see it a little later on, but not for today. Thank you.